Hello, I'm Denise Smith. Thanks for joining us for this presentation on cardiovascular concerns for women in the fire service. Let me begin by saying how thrilled I am to be part of this historic and important conference on women in the fire service. It's long overdue. And I greatly appreciate you joining us. Although I wish we were doing this in person, it's important that we begin this conversation, and hopefully we can rejoin in person soon. I'm going to talk about cardiovascular concerns in female firefighters, and I do this from a perspective of research that I've done in cardiovascular health and cardiovascular strain associated with firefighting for many years, both in my role as director of the First Responder Health and Safety Laboratory at Skidmore College and my work as a research scientist at University of Illinois Fire Service Institute. I think we all know that cardiovascular events are a leading cause of line of duty death among firefighters. In fact, the data presented over many, many years from the United States Fire Administration and the National Fire Protection Agency shows that about 50% of the line of duty deaths that they report are due to sudden cardiac events. And the numbers are far greater than the number of firefighters who are lost due to asphyxiation or burn injuries, the threats from fire that we think of as so hazardous. But for our work today, what we want to do is talk about the responses to firefighting in female firefighters versus male firefighters, because this work is relatively sparse. I'm going to review some of the data we have on women in the fire service, and some of it is great data, but it also points to the need for further research. So the coagulatory responses to firefighting are important to look at because they show us not only the cardiovascular responses, but some of the potential danger in the responses to firefighting. And in this graph, I'm going to present data on women and men. We're going to look at values before firefighting, pre-firefighting, and post-firefighting. So the graph you see on the left-hand side of the screen is looking at platelet count. This is the number of platelets in the blood, and it reflects the body's ability to form a clot. Now, forming a clot is good if you need it, and terrible if you don't. So what we see is that female firefighters have an increase in platelet number after firefighting activity. And in fact, that increase is very similar to what is seen in the male firefighters. Both groups increase by about 30% following firefighting activity. This is more than can be explained just through hemoconcentration or loss of fluid. This actually shows that the sympathetic nervous stimulation is causing a release of platelets. On the right-hand side, this graph is showing us the activated partial thromboplastin time. That just means the time it takes for a blood clot to occur. So the shorter time, it decreases after firefighting. It takes less time for a blood clot to occur, meaning that the blood is more coagulable. And this is potentially dangerous for someone with underlying cardiovascular disease because it means in the presence of any plaque rupture or tearing to the lining of the blood vessels, we're more likely to form a clot that could lead to myocardial infarction. So thinking about men and women, though, we see a very similar response. Both males and females have a decrease in APTT, a decrease in activated partial thromboplastin time after firefighting. So the blood is more coagulable, right? Now, it's not just the response to firefighting that we're interested in, but we're also interested in understanding basic health metrics of male and female firefighters. And there's been some great work done on this by our colleagues across the country. Lee, Lipsey, and Litch and Nelson investigated a group of firefighters in Colorado. And it's important to note that they're in Colorado, a state that's known for being active and fit. But here we see both female and male firefighters have a VO2 max, or an aerobic fitness value, above the 12 Met standard, or 42 mLs per kg standard promulgated by the NFPA 1582 committee. So firefighters, the male and female firefighters in this sample, had relatively similar fitness levels. And on the right-hand side, the measure of body composition. Both had body composition values in the good range. The female firefighters were in a better range relative to the fact that women typically have a higher percent body fat. Now, Sarah Janke's group has also investigated obesity in the fire service and gone on to present also some other cardiovascular disease risk factors. First, let's look at obesity among female and male firefighters, and notice now that they're actually going to report in the career side of the service and volunteer side of the service. And we see consistently that women have lower rates of obesity, a lower prevalence of obesity in the female firefighters compared to their male counterparts. And that's true in the career and volunteer side. Now, looking at the right side of the graph, these colleagues also present data on hypertension. The definition of hypertension has changed a little bit. In the light blue, you see the prevalence of hypertension defined as greater than 120 to 139. Sometimes this is called prehypertension. And then greater than 140, this is an older definition of high blood pressure. And you see, what I want to call your attention to is a higher prevalence in the volunteer service, but more importantly, an unacceptably high prevalence, 20% among the career, almost 50% among the volunteer fire service, of having elevated blood pressure. And we know that this is a risk for advancing cardiovascular disease. So it's certainly worth a great deal more research attention. Now, our laboratory has also collaborated with the Janke lab. Brittany Hollerbeck has led a project looking at fitness in the fire service using the criterion measure of measured fitness. Now, to do this study, we collaborated with our partners in occupational health clinics. This data is from Dr. Moffitt's lab, where they actually did a VO2 max test on a treadmill. And on the left-hand side, you see that the VO2 max of men and women is relatively similar when expressed in METs, or milliliters of oxygen per kg of body weight. In both cases, it's slightly below the national standard of 12 METs. But again, that data would tell us that men and women are similar in fitness values. But importantly, if we dig a little deeper and look at the data on the right-hand graph, now we see that in terms of a percent of predicted value, females are much more fit. Now let me explain this real quickly. If we look at an average person of fitness who's a female and an average person of fitness in the male population, females have a lower fitness value because they tend to have a lower body size, a smaller heart, smaller lungs, etc. So if we look at average fitness, and we predict it as a percent predicted, female firefighters are well above what's predicted in the general population. Now, we also wanted to look at cardiovascular disease risk factors, and recently our laboratory has done a series of studies on this. So let me show you this data. Again, we were collaborating with several occupational health clinics around the country and reviewing data from occupational medical exams. And when we do this with hundreds of firefighters across the country, we find that males have a greater prevalence of obesity. 29% of the male firefighters were obese, whereas only 10% of the women were. Similar patterns we see looking at the risk factors. High cholesterolemia, 32% among the men, 20% among the women. Low HDL. Remember, having a low HDL is negative. High HDL is protective. But a greater percentage of males have this risk factor. We see it with blood pressure and also with the use of anti-blood pressure medication. Now, we also wanted to look at how women compare in the general population to women firefighters. And here, this is really good news. Look with me, obesity. Not only is obesity less among firefighters than in the general population for women, but this is true across the years. So the blue line are our female firefighters. the black line, the general population. And for each age category, you see that the female firefighters have a lower incidence of obesity. Same thing with high cholesterol, tends to be lower. Same thing with low HDLs, lower among the females, until they reach the older age groups. Again, suggesting that we must watch this as a risk factor. Same pattern is seen in the other risk factors for triglycerides, blood glucose, and metabolic syndrome. Women are doing better than the general population, but firefighting is more strenuous than almost any activity that the general population undertakes. And so women firefighters must have better cardiovascular health. So in summary, women respond to firefighting in much the same way that men do. It's physically strenuous and leads to severe cardiovascular disruption for both men and women. But women have a more favorable cardiovascular disease risk profile compared to male firefighters in the fire service right now. They're leaner and fitter relatively with better blood lipid parameters. And women have a more favorable cardiovascular disease risk profile if they're firefighters than compared to the general population. But certainly, more research is needed to better understand the cardiovascular health concerns, and this is going to be increasingly important as we get more women into the fire service and retain them in leadership positions. We must understand the cardiovascular concerns of firefighters, how it changes with hormonal status, and how clinical manifestations of cardiovascular disease differ between men and women. Thank you again for joining the presentation.